The first trimester is the initial stage of pregnancy, lasting from conception, the first day of your last menstrual period, until the end of the 13th week. This period is a time of rapid development for the embryo and significant changes for the mother. Stages of pregnancy: pregnancy, birth, and baby. Pregnancy trimesters: everything you need to know. Stages of pregnancy: first trimester, Cherokee Women's Health Pregnancy Chart. What to expect. Each trimester. First trimester, weeks, development, physical and psychological. What happens to the baby during the first trimester? This is the most critical time for fetal development, as all of the baby's major organs and body systems form. During this time, the fertilized egg transforms into a tiny, but fully formed fetus. Key developmental milestones include weeks 1 to 4, the fertilized egg, or zygote, divides rapidly as it travels down the fallopian tube. It implants into the uterine lining and begins forming the placenta, umbilical cord, and amniotic sac. Weeks 5 to 8, the embryo grows arms, legs, eyes, and ears. The neural tube, which becomes the brain and spinal cord, is in place by week 5. The heart begins to beat, and the embryo starts to take on a more human shape. Weeks 9 to 12. By the 12th week, the embryo is now called a fetus. Fingers and toes are distinct, the external genitals have formed, and the fetus can make movements, though they are too small to be felt by the mother. Common physical and emotional changes for the mother. Due to surging hormones, a woman's body undergoes many changes during the first trimester. Symptoms vary greatly from person to person. Common symptoms include fatigue. Extreme tiredness is very common as the body works hard to support the pregnancy. Morning sickness. This can happen at any time of day and involves nausea and sometimes vomiting. Breast changes. Hormones cause breasts to become sore, tender, and swollen. The areolas may also darken. Mood swings. Hormonal fluctuations can cause a roller coaster of emotions, from anxiety to excitement. Frequent urination. The growing uterus puts pressure on the bladder, and increased blood volume causes the kidneys to process more fluid. Food cravings and aversions. Many women experience a sudden dislike for foods they once loved or a craving for new ones. Other symptoms: constipation, heartburn, and headaches can also occur. Important health considerations. The first trimester is a sensitive period, and it is crucial to take steps to protect your health and your baby's development. What to do? Schedule prenatal care. Find a doctor or midwife and book your first appointment. Regular checkups are essential. Take prenatal vitamins. Ensure your vitamin contains folic acid to help prevent neural tube defects. Eat a balanced diet. Focus on fruits, vegetables, lean protein, and fiber. Stay hydrated. Drink plenty of water throughout the day. Exercise safely. Listen to your body and engage in gentle activity, such as walking. What to avoid? Alcohol, tobacco, and recreational drugs. These can cause severe damage to the developing fetus. High mercury fish and undercooked meats. Avoid shark, swordfish, raw fish, sushi, and raw sprouts to minimize the risk of infection. Unpasteurized dairy and juices. These can carry harmful bacteria. Excessive caffeine. Most doctors recommend limiting caffeine to under 200 milligrams per day. When to call a doctor. Contact your healthcare provider if you experience any of the following symptoms: heavy vaginal bleeding or severe abdominal pain, a fever over 100.4 degrees, 38 degrees E, persistent vomiting and/or diarrhea, severe cramping or dizziness and fainting spells,